This is Dr. Ross for the third video presentation in our axial muscles presentation series. I'm going to start, we're going to discuss in this one muscles of the thorax and abdomen. So muscles of the vertebral column, thorax, and the abdominal wall extend, flex, and stabilize different parts of our trunk. Now deep muscles of this area are going to also help in maintaining posture as well as carrying out other functions, and we'll discuss that as we move through these different muscle groups. So in this slide I want to talk about vertebral column movement. We're going to start with the longissimus thoracis muscle, which is part of the erector spinae group. So you can see that here there are three muscles that are part of this group, and the middle one is the longissimus thoracis. This is it has a bilateral action, all right. And so when that happens, you have the extension of the vertebrae column. Again, this is going to be on either side of the spine, not just the spine shown in the picture. When only one of these muscles contracts, or unilateral action, it's going to rotate the head as well as laterally flex the vertebral column. The origin is the mastoid process of the temporal bone, as well as the transverse process of some cervical and thoracic vertebrae. The insertion, if you look down below, is the tendon from part of the iliac crest. So next I want to discuss muscles of respiration. So muscles of the chest often serve to facilitate breathing, and they do this by changing the size of the thoracic cavity. We're going to talk about this in a lot of detail in anatomy and physiology too. When you inhale, your chest rises, and that's because that cavity expands. Alternatively, when you exhale, your chest falls, and that's because obviously the thoracic cavity decreases in size. And there are muscles that aid in that, all right? The most important of which is the diaphragm, shown here. Again, the diaphragm is going to extend all the way across the body. We're just looking at part of it in this image. So the diaphragm can alternate between contraction and relaxation, like all muscles, but when it does so, it changes the volume of the thoracic cavity. Contraction of the diaphragm basically causes it to flatten, and when that happens, it moves down and it expands the thoracic cavity. When it relaxes, it moves back up, and this decreases the volume of the thoracic cavity. The origin of the diaphragm is the central tendon, and then the insertion is the internal surface of your ribs number 7 through 12. It also inserts at the xiphoid process of the sternum, as well as the costal cartilages of the of 6 ribs. And it also inserts at some of the lumbar vertebrae. So this is attached to quite a bit of area. So the next group we're going to talk about are the internal intercostals. Again, these are going to be located on either side of the sternum. We're just looking at one set. Okay, and this is this kind of lighter area here. These are going to depress, when they contract, they depress the ribs during forced expiration, which is when you exhale beyond beyond normal breathing. It's going to be a stronger exhalation. The origin is the superior border of the inferior rib, meaning each one is attached to the upper side of the rib below them. They are inserted to the inferior border of the superior rib, which means they are inserted at the lower border of the rib above them. Next are the serratus posterior inferior muscles. And these are going to also depress the ribs during forced expiration. In this case, the origin is the inferior borders of ribs 8 through 12 or 9 through 12, and the insertion is the spinous processes of your thoracic vertebrae number 11 through the lumbar vertebrae, through the 3rd lumbar vertebrae. Now let's move on to muscles of the abdominal wall. There are 4 pairs of abdominal muscle that cover the anterior and lateral abdominal region, and they meet at the anterior midline. which is shown in this image. Okay, these muscles of the abdominal wall can be divided into four groups: the external obliques, the internal obliques, the transversus abdominis, and the rectus abdominis. So first let's talk about the rectus abdominis. The rectus abdominis flexes the vertebral column and compresses the abdominal wall. They are very important for posture. The origin is the xiphoid process of the sternum, as well as the inferior surfaces of ribs 5 through 7. The insertion is the superior surface of the pubis near the pubic symphysis. So there are three flat skeletal muscles in the anterolateral wall of the abdomen, and this includes the Transversus Abdominis. So this has a bilateral action as well as a unilateral action. The bilateral action, so this is when the muscle on each side flexes, you're going to have, or contracts, you're going to have flexion of the vertebral column and compression of the abdominal wall. The unilateral action, when just one of them is contracting, you're going to get lateral flexing of the vertebral column. The origin here is the iliac crest, as well as cartilages of the inferior ribs. And then you're also going to have insertion at the pubic crest as well. Now, this is not a great image of the transverse abdominis because this muscle is very deep here. So you may want to look at this muscle on its own in another image. So the other flat skeletal muscle that belongs to this group is the external obliques. So the external oblique is a cut in this image. So again, I highly recommend looking at it in another image. This is going to flex the vertebrae and compress the abdominal wall. It's the largest, and it's also the most outermost of these three flat abdominal muscle. So when both on either side of the body, so when you have bilateral action, meaning both on either side of the body, when these both flex or both contract, you're going to get flexion of the vertebral column and compression of the abdominal wall. And unilateral action, meaning just one side contracts, you'll get lateral flexion of the vertebral column. You will also get the rotation of the vertebral column to the same side of whichever muscle contracted, whichever side of that muscle contracted. The origin here is going to be the external and inferior borders of 8 of the ribs. I think it's ribs 5 through 8. The insertion is going to be some of the iliac crest as well as some connective tissue. Finally, the third muscle in this group is the internal oblique. The internal oblique performs two major functions. First, it's an accessory muscle of respiration. It acts as an agonist to the diaphragm, and so this helps to reduce the volume of the chest cavity during exhalation. Now, contraction of this muscle causes rotation and side bending, and it acts with the external oblique muscle on the opposite side to achieve torsion. So, for example, the right internal oblique and the left external oblique are going to contract as the torso flexes and rotates, bringing your left shoulder towards your right hip. Okay, so try this movement and listen to this again. Okay, so for this reason, the internal obliques are referred to as same-side rotators. Again, there's both a bilateral action, meaning both of your internal obliques working together at the same time, and a unilateral action, meaning just one of them. So bilateral, when they contract, you get flexion of the vertebral column and compression of the abdominal wall, just like with the other two muscles in this group. And then unilateral contraction will cause lateral flexion of the vertebral column and rotation to the opposite side. The origin here is going to be the inguinal ligament as well as the iliac crest. The insertion is the pubic crest, inferior rib surfaces of 4 of the ribs, 9 through 12, as well as the costal cartilages of ribs 8 through 10. So for these muscles of the abdomen, I highly recommend trying to pull up some images and look at them by themselves on a skeleton with just those muscles, so you can really get a sense of where these insertions and origins are, as well as how big these muscles actually are. The last thing I want to discuss on this image, or show in this image, is the external and internal oblique, showing you from the side view. So this gives you a little bit of a better view of those two muscles. You can see the external oblique here is a little bit larger in this upper image and would be covering the internal oblique, as its name implies. And then finally, the rectus sheath, which is covering the abdominal muscles. This is connective tissue. It's very durable and it's fibrous. It's a compartment that contains those rectus abdominis muscles as well as another muscle. And that is it for this presentation, as well as our axial muscle series.